medical misinformation is everywhere. Dr. Mitch is here for straight talk and to give you the truth.
Many patients often ask me, why do I wake up so tired? Now, we've looked at previously why people can't get to sleep. In today's episode, I'm Dr. Mitch Ghen. We're going to talk about poor sleep hygiene and why folks have difficulty getting up in the morning. Well, there's several reasons. I'm going to try to give you as many that will help you clinically to determine what things that you could do to help these patients. Sleeping in a noisy or brightly lit room will certainly lead to poor quality sleep. As you know, if you go to bed with something more light than a 3 lux type of lighting, it's not going to give you a good sleep architecture, and therefore you're going to wake up and be tired. Late night tech use, that blue light that's emitted from screens, which you could block, suppresses also the production of melatonin and also irregular poor sleep. Talking about irregular sleep, the irregular sleep schedule is an issue as well. Going to bed and waking up at different times every day, well, that throws off your circadian rhythms and that internal clock that we have. Sleep apnea, obviously, we tend to look for that and we try to correct it. Restless leg syndrome and even narcolepsy can contribute to poor sleep architecture as well. Now, of course, acute and chronic pain can cause a problem, especially if the pain stops in certain positions, and when you roll over or move, it can also awaken that particular patient. We talked about how waking up early is often anxiety, waking up difficultly, tired, or having a hard time facing the day is often depression. So consider depression or even anxiety in wake up somnolence. Dehydration. There's studies show that if you do not have enough water or a lack of water in your diet, for sure you're going to feel tired during the day. By the way, that's true in general. 1 glass lack of water decreases the fatigue level or increases the fatigue level by 20%. Lack of physical exercise, not having enough activity or exercise activity, you're not going to get those muscles to work properly. They're not going to be relaxed at bedtime. You're not going to get the circulation that's required. Overeating late at night. I tend to tell patients, listen, don't eat 3 to 4 hours before bedtime. It leads to a potential of heartburn and irritation, let alone, the body's working to digest it. Drinking a lot of alcohol before bed also can cause issues with getting a good night's sleep. Although, yes, as a depressant, it could make your sleep cycle distressed and, of course, wake up tired. Stress levels. Carefully evaluate your patients and make sure they're not worried or stressed. And of course, also certain medications can do this, including beta blockers, which inhibit the very first step of melatonin production, selective serotonin uptake inhibitors. Some antidepressants can disrupt sleep as well. Others, corticosteroids, diuretics can increase urination and interrupt your sleep. Statins can cause muscle pain, as you know. Check the CPK. ACE inhibitors, they can lead to cough or even restless legs, also can have caused problems. Then there's the nutrient deficiency category we don't want to forget. Iron deficiency, anemia can cause fatigue and weakness and dizziness, so the mornings become difficult. Vitamin D deficiencies have been linked to excessive daytime sleepiness. If you have a lack of B vitamins, you could be fatigued. Magnesium helps regulate, as well as calcium does, the brain's production of melatonin. One other thing I don't want to ever forget is potassium, because all we think of is someone has cramps, it's magnesium, magnesium, magnesium. If you know it's hot and there's patients sweating a lot, it could be sodium, but do not forget potassium. Our body needs somewhere between 20 and 120 milliequivalents repletion a day, depending on the amount of loss that we have, whether there's diarrhea or there's excessive diuretic action or excessive sweating, etc. It is a potential cause of sleep disturbance and, of course, of muscle pain. Thank you so much for taking the time to watch this video. I hope these videos are helping with your patients. If you have any idea that you would like to hear more about, please feel free. Just contact me at drmitchghen.com. That's drmitchghen.com. Thanks so much again for watching. Have a great day.